Good morning and welcome to Preventing Pathogens in the Pipeline, Performing Building Water Systems Risk Assessments. Thank you to Chicago Faucets for inviting me to speak. I'm Megan Canwright-Roscoe. I'm the Director of Scientific Operations with Forensic Analytical Consulting Services. And when we first started talking about the topic for today's presentation, what we really wanted to focus on was the actual performance of building water systems risk assessments. A lot of these guideline documents that we have for the control of waterborne pathogens talk about risk assessment, but don't necessarily give prescriptive guidance about what a risk assessment is. So I'm hoping to provide some clarity for you today and also provide you with some resources. So I'm going to give a brief introduction. I'll talk very briefly about building water system hazards. We'll touch on some of the industry regulations, standards, and guidance that is available to you. And then we're going to get into the meat and potatoes of building water system risk assessments and the principles of that. I'd also like to walk you through a couple of the water infection control risk assessment or WICRA tools that are available to you. And then we'll talk a little bit about planning and design considerations for when you're thinking about Legionella and water management control as part of a new project or new construction. And we'll finish up with Q&A. So brief introduction, why is this important? And I know we've heard a lot of statistics about Legionellosis, but we don't often see statistics about other waterborne pathogens and other etiologies. However, Legionella does account for a good portion of multiple person outbreaks. Benedict did a study in 2017 that looked at the source of the etiologic agents, the causes of NORS reported disease outbreaks. And so these are multiple person outbreaks where there are multiple people come down with an illness. And what they saw is that for between 2013 and 2014, that the vast majority of these multiple person outbreaks were resulting from Legionella bacteria. And then the other non-Legionella bacteria made up a much smaller percentage, 2% of those multiple person outbreaks. So while Legionellosis cases are not necessarily the highest raw number of cases that we see with respect to waterborne illness, we certainly expect them to account for the most multiple person outbreaks where a lot of people come down with the illness. And then the CDC published a study recently in 2024 where they looked at the agents that were associated with multiple person outbreaks, and again confirmed these findings and found that Legionella is most often the causative agent when we look at multiple person outbreaks. In terms of the industries that are impacted by waterborne illness, really any industry can be impacted by waterborne illness, as you can see from this graph here. Anything from amusement parks to hotels to healthcare, even community and municipality infections are seen from municipal sources of water. But what this graph is showing is it's looking at biofilm. The most significant thing that it's showing is biofilm-associated outbreaks. And so what biofilm-associated outbreaks are there cases of illness that are that look back to any one of three bacteria: Legionella, Mycobacterium, and Pseudomonas. And so what we can see is that by far, healthcare facilities are most impacted by outbreaks of illness from biofilm-associated organisms, with a close second of the hospitality industry: hotels, motels, lodges, inns, etc. But really, any industry can be impacted by these illnesses, and so it's important for facilities to think about water management and what steps to take to prevent these illnesses from occurring. CDC is a little bit behind in updating this graph, but they have been tracking Legionnaire's disease cases for some time. Legionnaire's disease is a reportable illness. And so as you can see, we've definitely seen a great increase in Legionnaire's disease cases, at least those that are reported, between 2000 and certainly 2019. The 2019, 2020, 2021 kind of dip that you see there is related to the COVID pandemic, where we saw a lot of building closures. People were not in buildings as much, certainly not community or public buildings as much. And so we suspect that may be the reason for the dip in some of the cases. The reported cases, there was also a real focus, obviously, on COVID cases and reporting there. So there may have been misses with respect to getting the right data for that period of time. But we do suspect that once CDC catches up with reporting data for the last 3 years, that we will see resume those increased cases of Legionnaire's disease. And not only is this important from a healthcare and patient health or human health perspective, but it's also financially important because there's major financial implications for waterborne illness. A study that was published in 2023 looked at, in just a 1-year period in 2014, what the cost of waterborne illness costed the United States. And essentially, they looked at both at infections from drinking water and then infections from all other water sources, which would be recreational water and then non-recreational, non-drinking water. And what they found were there were 7 million infections related to water overall, and over 1 million of those infections were related to drinking water sources. They resulted in over 600,000 ER visits, almost 120,000 hospitalizations, and over 6,000 deaths. So significant burden of illness and burden to the healthcare facilities and healthcare costs. And these, in totality, these waterborne illnesses cost the US about $3.3 billion. Specifically with drinking water, we saw that Legionellosis, there were about 6,000 hospitalizations. For non-tuberculous mycobacteria, over 35,000 hospitalizations, and Pseudomonas, almost 2,000 hospitalizations. And remember, these are the big three: the Legionella, non-tuberculous mycobacteria, and Pseudomonas are these biofilm-associated pathogens that we typically see as the etiologic agent in these illnesses. And so what the study found was that most hospitalizations and deaths are actually caused by biofilm-associated pathogens, and to the tune of over $2 billion annually. So a significant financial burden in the United States. And I like to look at the Flint, Michigan crisis because I think it's a really good example, even though it happened about 10 years ago now, almost 10 years ago now. It's a really good example of how issues with water quality can not only lead to cases of waterborne illness, but also exposure to other waterborne contaminants. So I'm not going to talk about other waterborne contaminants very much today, but keep that in mind, that where you have cases of waterborne illness and where you have water quality issues, it's not just about bacteria exposure or pathogen exposure, it's also about water contaminants. Other physical and chemical agents can be at play. So Flint, Michigan crisis, essentially what happened is in 2014, there were some changes to the city water treatment process that basically led to decreased use of corrosion inhibitors and increased corrosion in the pipework in the municipal supply. And then that led to lead contamination. We saw increased leaching of lead in the public water supply, which led to exposure for end users. And then we also saw, commensurate with that, increased cases of Legionellosis, significantly increased cases of Legionellosis. This, resulted in emergency regulations and interim drinking water standards that were set by the EPA. And the burden of this is still being seen today, or the cost of this is still being seen today, because litigation is still ongoing related to human health exposures that occurred during that crisis. And this is a good segue into building water system hazards, because when we look at potable water treatment, it's a delicate balance, as we saw in the Flint, Michigan crisis. Raw water needs to be treated because we don't want to expose people to waterborne pathogens. So we want to get rid of Giardia and Cryptosporidium and E. coli and other organisms that can cause human illness. And so we add chlorine, or we add monochloramine. We add a disinfectant to try to bring down that pathogen risk in potable drinking water. When we add a disinfectant, it changes the water chemistry and we get disinfection byproducts, trihalomethanes and halacetic acids. We also get corrosion because, again, the water chemistry changes. And so we need to think about how to control that corrosion. So we add corrosion inhibitors to prevent lead and copper and other materials from leaching out into the water. So we're doing a delicate dance of trying to balance the water chemistry to control pathogens, to make sure that there's residual disinfectant and make sure that we don't have too much corrosion. And it can be difficult especially given the large volume of water that moves through piping every day. So when we're thinking about water quality, we think about a few different hazards. There's certainly biological hazards. These are pathogens, microbial pathogens, bacteria, viruses, protozoa, even fungi. chemical agents, so certainly disinfection byproducts, corrosion byproducts, lead, metals, other plastics, other materials, and then certainly physical hazards. And physical hazards are usually things like sediment and particulates, or can even be related to temperature. So if we're increasing temperature to scalding temperatures, that can certainly present a hazard to building occupants as well. And touching a little bit on opportunistic pathogens, again, I mentioned the kind of the big three: Legionella, non-tuberculous mycobacteria, and Pseudomonas. And there's certainly other opportunistic pathogens, waterborne pathogens, that are of importance as well. But we often look at this group of organisms as biofilm associated. So Legionella, you can be exposed to Legionella bacteria by inhaling aerosols or accidentally choking or aspirating when you're drinking contaminated water and aspirating those aerosols into the lungs. Causes Legionnaire's disease. Legionnaire's disease has a pretty high mortality rate, up to 30%. It can be even higher in healthcare facilities where immunocompromised people might be housed. And then it also causes two other illnesses: Pontiac fever, which is more of a flu-like response, and then extrapulmonary legionellosis, which is a group of illnesses related to Legionella infection outside of the lungs. And there can also be medical complications from any of the above illnesses. And so certainly we want to control Legionella in water systems to prevent these illnesses from occurring. I'll talk a little bit about non-tuberculous mycobacteria and Pseudomonas later on, but these organisms, unlike Legionella, have more of a risk of direct contact or person-to-person contact, whereas Legionella does not present that risk necessarily. So Legionella risk factors, and we often look to Legionella as kind of an organism whereas if we're controlling Legionella, we're typically controlling for other organisms. It tends to have a fairly wide growth range. It's not always the case that we're controlling all organisms with Legionella, but it's often used as sort of a maybe not a marker organism, but we look to the control measures for controlling Legionella to try and control other organisms as well. So the ideal growth range for Legionella is between 77 degrees and 113 degrees, according to the CDC, but it can grow at a wider temperature range between 68 and 120, and sometimes even outside that range. Another risk factor for Legionella is low flow or no flow building closures or reduced occupancy, areas of construction which may be shut down to allow for that construction, or even dead legs that are engineered, or effective dead legs in the building, fixtures that are not used frequently. And then low or no disinfectant is another risk factor. Disinfectant can be lost with stagnation as water is in contact for long periods of time with pipework sitting in the pipe. You can lose the disinfectant, and then disinfectant can also be lost with exposure to high temperature, such as in a water heater. And then the presence of corrosion and scale. This can happen with stagnant conditions. Again, as water ages in the pipe, it can settle, some of the scale can settle out, cause scaling conditions. And then we can also get biofilm formation that attaches really easily to scale deposits within building water systems. And there's a lot of different, we could spend a whole webinar talking about water systems that are at risk for waterborne pathogens. Certainly cooling towers, showers, hot tubs, fountains, anything that makes certainly a visible aerosol, but also a non-visible aerosol. Fixtures like sink fixtures generate an aerosol that may not necessarily be seen and are certainly a risk. So potable water systems do present a risk for Legionella and other waterborne pathogens. NTM mycobacteria, they're commonly found in municipal water and premise plumbing. The most common causative agent is Mycobacterium avium complex. It's an opportunistic pathogen. So as with Legionella, mostly immunocompromised people are at risk, but it can infect healthy individuals as well. Exposure can happen either through contact with aerosols and inhalation with aerosols, or direct contact with a surface or piece of equipment that is contaminated. Causes illness, lung infection or disease, soft tissue infections, can infect medical implantations, and infection can even be asymptomatic. And we see Mycobacterium in a lot of different water sources, but often in pools and spas and potable water, water heaters, and the like. For Pseudomonas, also an opportunistic pathogen. So again, immunocompromised people are at higher risk. We often see Pseudomonas aeruginosa as the etiologic agent with illness related to Pseudomonas, but other organisms, other species can also be implicated. Exposure happens either through inhalation of aerosol or contact with aerosol, direct contact, and it can also, person-to-person contact can also occur. Pseudomonas can commonly colonize the skin, throat, and a stool of healthy people, so asymptomatic colonization can occur. Illnesses that it causes are pneumonia, eye, wound, ear, and soft tissue infections, and it can cause sepsis as well. And again, Pseudomonas, we see it in a lot of different water sources, but pools and spas, respiratory equipment, humidifiers, ventilators, et cetera. So now that I've given a little framework for some of the organisms that we're thinking about with respect to control, I want to talk a little bit about industry regulation standards and guidance. And again, there's a lot to break down here. I'm really just giving you a snapshot of some of these. There's a lot of references that are available for you to refer to when looking at managing building water systems. But regulations are really required by law. They're really the only requirement or the only mandatory action that needs to be taken is that's dictated by regulation. So some examples of that, we'll get into it, but Centers for Medicare and Medicaid Services is an example. Then we have standards, industry standards, and these are voluntary standards. The purpose of these voluntary standards is typically to become part of code. So what the idea is that these standards are established and then eventually they will be adopted as part of building code, plumbing code, et cetera. Some examples here are ASHRAE and ASPE, the American Water Works Association. And then we have guideline documents, which are really best practices, and these are typically peer-reviewed organizations that are publishing guidance. These are organizations like CDC and AIHA publish guidance. So really the only regulations that are related to waterborne pathogen control in some way are the EPA Safe Drinking Water Act, the EPA FIFRA Federal Insecticide, Fungicide, and Rodenticide Act, which governs how disinfectants are used to treat water, the EPA Disinfectant Byproduct Rule and Disinfectants Rule, which talks about how disinfectants are applied also to municipal water. And then there's a couple of healthcare directives and memos, the Centers for Medicare and Medicaid Services Memorandum and the VHA Directive, Veterans Health Administration Directive, which mandate the implementation of water management plans in healthcare facilities. And then the General Service Administration Directive, it can be a directive such as requiring sampling to be performed in certain government-owned buildings. There can also be state and local legislation and regulations. Michigan, New York State, New York, Jersey, and others have adopted regulations that either require healthcare facilities to have water management plans or perhaps for cooling towers to be registered, among other things. And then there can be local city regulations as well. Some examples here: New York City, New Orleans, and Garland, Texas have Legionella-related regulations. And then there also are some permits. Some states require permits for supplemental disinfection, adding supplemental disinfection for managing water. That is dependent upon the state. Some states have them, some states do not. There's a variety of different voluntary standards out there. This is just 3 examples here, but we have ASHRAE Standard 514, which talks about managing other hazards, building water systems for other hazards as part of Legionella management. We have ASHRAE Standard 188, which talks about minimum risk management requirements for building water systems, talks about water management plans. And then we also have the ASSC IAPMO 12080 series of standards, which outline minimum qualifications for being a member of the water safety team. And then finally, our guidelines, we have ASHRAE Guideline 12, which gives detailed control measure recommendations for building water systems. There's an AIHA guideline, which walks people through the risk assessment process and makes recommendations for control. We have the CDC Controls Toolkit, which is a practical guide for implementing industry standards. And then we have the CDC Water Management Plan Development Kit, which provides kind of real life examples, simplified examples for what a water management plan might look like. And I want to talk about risk assessment principles, because again, a lot of these documents that I just reviewed, they talk about risk assessment, but don't necessarily walk the assessor through how to actually perform a risk assessment. So in terms of building risk assessments, they can either be qualitative, quantitative, or a combination of both. My recommendation is that you start with a qualitative assessment, which doesn't necessarily involve collecting Legionella samples, so that you can establish a knowledge about the building water system before taking those samples. Why not just take samples? Well, if you just go and collect samples randomly within the building, it'll be really hard to put the results of those samples into the context of the building water system or into the context of the risk. So my recommendation is that the building water system should really be understood before those samples are collected. And the population of the building needs to be evaluated for risk as well. So the qualitative risk assessment is done to identify potential amplification sites and transmission sources, and then help to evaluate and prioritize which of those risks to address first. And it's really good information or necessary information for developing a targeted sampling plan. So those samples are taken to validate the qualitative risk assessment results, to sort of confirm that the areas of risk that were identified are actually areas of risk, rather than just taking random samples and having to try to interpret those outside of the context of the building. When we're thinking about risk assessment, we really need to think about all water exposure routes, especially if we're thinking about all waterborne pathogens. So exposure to waterborne pathogens can occur from ingestion, that's drinking contaminated water, or other fluids that have been made with contaminated water. It can be eating food that's grown with contaminated water, or eating food that's washed in contaminated water. Then we have inhalation, so inhalation of contaminated aerosols, which then deposit into the lungs. And then we have aspiration, which is accidental choking and subsequent inhalation into the lungs. And then we have dermal exposure as well. So exposure through the skin, eye, and mucous membranes, which is not necessarily as important for Legionella, but is certainly important for other waterborne pathogens. And the purpose of the qualitative building risk assessment, as I mentioned, is to identify areas of potential amplification and areas of potential exposure within the building. So at a minimum, what we're doing is we're going through the building and we're identifying areas where water temperature can be in the growth range of the organisms. We're identifying areas where water is stored or recirculated, areas of low pressure. We're trying to identify areas of stagnant water. We're trying to identify dead legs, whether those are physically capped dead legs, so physical dead legs, or engineered dead legs, as I call them, or effective dead legs, which can be, an example would be a fixture that is not used. So it's essentially creating a dead leg without being an actual capped pipe. And then the presence of scale, sediment, biofilm, or organic material, where aerosols or mists are produced, identifying points of high risk exposure. We might be identifying areas of recent closure or construction, or possibly disruption in service from the municipality. We want to make sure that there aren't any design deficiencies that we're able to identify. And then, of course, we're going to want to identify if there are any susceptible populations to the best of our ability. So the first step in the qualitative risk assessment, and my recommendation, is to look at the building history and the design, and to review that very carefully before you ever step foot in the building. You're going to be looking for a history of cases. Have there ever been cases of illness? Have there ever been positive Legionella results that identify amplification? Any disinfections that have occurred beyond regular commissioning? And then looking at the architectural drawings and as-built, trying to figure out how is the water system distributed, and looking at how that water system was commissioned during that construction period. Was it disinfected and appropriately flushed? And is there a record of that? Certainly looking at the construction phases, how long did construction occur? Were portions of the building constructed at different times? And were there tie-ins to the building water system at different times? That's important information to understand. Have there ever been periods of water stagnation, meaning was the piping ever charged without beneficial occupancy? We're going to look at areas or periods of low pressure or low flow. And then ideally, we're also looking at records review. So if the building has a cooling tower, for example, is that cooling tower treated, and is there regular records of its management and treatment? So this is an example of a riser diagram. Riser diagrams are extremely useful when trying to understand the building water system. They give you kind of a one-stop picture of how the water flows within the building and how it's how it comes into the building, how it's processed, how it's tempered and heated, and then how it gets out to various floors and fixtures within the building. So the plumbing diagrams can help you to identify dead legs. Maybe there are areas that aren't built out, they're shell spaces. We need to find areas of future tie-in. We can see very easily how many water heaters there are, what types of water heaters. So these riser diagrams and the plumbing diagrams and fixture schedules can be really helpful before you even step foot on site. And then with that information, you can really start your building water systems inventory, and this can help to guide the areas that you walk through in the building. So you're going to want to know where the municipal points of entry are in connection, where there's backflow preventers, how many water systems are there? Is there hot? Is there cold? Are there multiple hot water loops or subordinate return loops? How is water tempered and processed? How is it stored? And what kinds of fixtures and connections are present within the building? And then you're going to want to inventory non-potable water systems. Is there any evaporative cooling going on, a cooling tower, a swamp cooler? Is there any irrigation or humidification or recreational water like a spa or hot tubs? Any decorative fountains? And then if you were able to discern whether there were any known or potential dead legs from the plan review, you're going to want to inventory those as well. And from that information, you can typically generate a pretty good flow diagram. And this is a good tool to take out with you when you do the building walkthrough, so that you can understand very easily how water is distributed, how it gets in from the municipality all the way through the building to the points of use. So then you do your building walkthrough assessment. And the purpose of this is really to confirm the construction. You want to make sure that what you saw in the plans and what you've inventoried in your building inventory, that's correct. And you can physically confirm that. So visually assessing equipment, fixtures, and storage areas, you're going to be looking for those risk factors. Scale, is there sediment? Are they properly maintained? Is there good water movement and flow? You can identify those dead legs if you see any as part of your assessment, and you can verify if you identify dead legs in the plumbing plan review, you can verify if those are actually installed. You're going to want to collect water quality operating parameters, things like temperatures, things like residual disinfectant, pH, and other water quality parameters to help you establish a building profile, and this helps inform your risk assessment. If you're aware of cleaning or disinfection procedures, let's say for cooling towers, you can evaluate and confirm that while you're on site by physically inspecting the cooling tower, looking at the treatment equipment, trying to find areas of low flow or pressure issues. If there's supplemental treatment involved, you can verify and validate what kind of treatment is being implemented and how it's being managed. Performing an inspection of heating and other tempering systems. Are there hot water heaters? Are there thermostatic mixing valves? And you can do visual inspections of all of those equipment, in addition to verifying cross-connection prevention and the implementation of backflow prevention. So once you have all the information from the building review, the inventory, and the building walkthrough, now you can start to compile all of the information and characterize the risk and really prioritize it based on risk. So you're going to look at all of the information that you just gathered. Water temperatures. Are there water temperatures in the growth range of the organisms? Is there sufficient residual disinfectant? Is there presence of scale, sediment, or biofilm? Compiling all that information can help you to collate all of the areas of risk and then start to prioritize them so that you're addressing the areas of highest risk first when making recommendations for control measures. And at this point, that qualitative risk assessment can be validated with samples. So once you've prioritized those areas, you can design a sampling plan that is focused on those highest priority areas. So you're making the best use of time and money when collecting samples, and also addressing and validating that those areas are high risk areas and whether they're controlled. So there's quite a few tools that are available for you when performing risk assessments in building water systems. And most of these tools are designed specifically for healthcare. There's a couple I'm going to show at the end that are not, but we can still draw some really useful information from the healthcare-based Wicker tools. So this is the CDC tool. It is looks at kind of multiple categories or conditions. And then what it does is it makes you think about those different conditions and put them into a table, assigning them a semi-quantitative numerical value to help you calculate a semi-quantitative risk. And this tool is really useful for helping to prioritize areas of risk. So the tool will ask you, what water sources are people exposed to? It gives you some examples there. All of these water sources are going to want to go into the risk assessment tool. Anything you identify, even if it's a low risk system, you want to put it in the tool. You also want to think about modes of transmission. How is it happening? Is it direct contact, indirect contact, inhalation, ingestion? What are the ways that people could be exposed? You can think about occupant susceptibility. So in healthcare, these are patients. Most other buildings outside of healthcare will probably have moderate to low patient susceptibility, although a person of high risk can be on site at any time, and we don't know about it. And then you want to think about what the risk of patient exposure is. Is it high, medium, low, very high, or is there no potential for exposure? And then it also asks you to incorporate your current preparedness. What control measures are currently implemented, and how well are those control measures working? So it takes those categories and then puts them into this tool. It asks you to assign a numerical value between 1 and 4, or 0 to 3, or 1 and 3. In some cases, it gives you guidance up at the top of the tool. And then those numerical values are added into the tool and then cumulatively totaled in the final column there to generate a total risk score. And so in this way, because you're generating these numerical scores, you can rank them, and that can help you to prioritize your risk. So it's a really great tool that incorporates a lot of different risk measures or conditions, and is really useful even outside of healthcare. ASHE also has an infection control risk assessment process. This was updated from the original process to ICRA 2.0 several years ago. What's great about this tool is that the previous iteration didn't really think about water. It was more focused on construction and dust control and air contaminants. And so this ICRA 2.0 process does cause you to think about water, at least asks you some questions related to water. So you'll see a very similar risk matrix here. We're taking the patient risk groups, which can be low, medium, high, or highest, and then we're looking at building type. Building type can be, activity type rather. Activity type is, anything from type A, which is pretty non-invasive, to type D, which is major demolition or construction. And so it's asking you to matricize the risk and the activity type, and then it gives you these risk control groups from 1 to 5, which really dictate what control measures and what level of control measures need to be taken based on the risk and the activities performed. So here's just a close-up here. It kind of guides you through how to categorize low, medium, high, and high risk patients. And here's a close-up of the matrix here. And then the ICRA process gives you specific recommendations for the type of control measures that need to be performed. And here's just a close-up of the ICRA permit, which really triggers the water management team to think about water systems. It's really only a one-liner, so there are other tools that can really be used in a supplemental way to help identify more specific water control practices. And one of those tools here is the IAPMO construction WCRA. So very similar, you'll see this kind of matrix style risk assessment tool as well, but this is a construction risk assessment, or it's intended for construction projects. So you'll have the water management team as well as the construction water steward, a member of the construction team involved. It's going to, the recommendations are to, just as I mentioned with the qualitative assessment, essentially review information, history, drawings, floor plans, make sure you understand the building water system as part of completing the tool. That's a really critical step. So then the IAPMO WCRA asks you to look at building water system type. So it runs you through the different categories here from A to D. A is sort of a simple water system that doesn't have a whole lot of, high risk equipment, all the way up to type D, which is a more complicated water system, multiple water systems, multiple high risk equipment there. And then it asks you to determine the risk control group. This is very similar to the ICRA and the CDC WICRA process, where we're looking at low, medium, high, and highest risk individuals. For most non-healthcare facilities, you're going to have typically low risk occupants. Maybe there might be some medium there. And then again, you're sort of putting this information into a matrix, and that is helping you to determine what control levels between 1 and 4 are recommended in terms of controlling water during the construction process. And here are some examples. These classes build on each other. So if you're going to be implementing class 2, you would also need to implement class 1, et cetera. So class 1 is, again, the lowest level of class. It's, maybe some general water quality, temperature monitoring, all the way up to class 5, which might include more rigorous monitoring, maybe testing and sampling. And then IAPMO also provides, in the 12080 series of series standard, it gives an example of a construction WICRA permit. So that IAPMO process, construction WICRA process, can be used to issue a permit, which is a great way to communicate the water management team's recommendations and requirements to the whole construction team. So it can be actually posted on the construction site. We recommend that a multidisciplinary team be engaged to issue the permit, and that all of those perspectives from engineering, from infection control, or from a Legionella consultant or EH&S or safety person, that those are all incorporated into the recommendations that are made as part of the permit process. So with that, with those tools that are available, I want to talk a little bit about planning and design, because the best time to think about water management and water risks is during the design phase, as part of developing the drawings and the architectural drawings. So these are some of the guidelines that talk about planning and design considerations. IAPMO has a great resource called the Construction Practices for Potable Water, which talks about water management practices during the construction phases and also the design phases. And then it also gives some really good recommendations for commissioning and validating that commissioning is ready for occupancy. So the reason that we focus so much on construction is because the CDC has estimated that 75% of unmanaged external changes that have resulted in outbreaks of Legionnaire's disease were directly attributable to construction activities. So construction activities, because of the water stagnation that occurs, because there's a lot of debris and contamination events that can occur, are high risk activities with respect to Legionella. And the reason for this is really looking at, when we look at construction timelines with respect to water, the designing phase happens in the beginning of the project. And then once the design occurs, we have primary construction. So the piping goes in. First, the cold water system goes in, then the hot water system goes in. And then we might be establishing water service to the facility, so the point of connection to the municipality. And then we do the fill and test. So we actually charge the system we flush it to remove construction debris and sediment. And then we do pressure testing, typically with water. And this can happen on the order of days, typically. So we have the water system that's filled with water at this point. And then we have months to years for the finishing to occur. So this is all the other construction activities, putting in the HVAC system, putting in the finishing, the drywall, the ceiling coverings. And the whole time, and this can take months to years. And so the whole time that all of that finishing work is done, that water system is just sitting there stagnant, possibly generating biofilm, growing biofilm and waterborne pathogens. And then finally, the commissioning occurs before beneficial occupancy. There's a pre-disinfection flush, there's a disinfection, and a post-disinfection. And typically all that's required is that E. coli sampling, total coliform and E. coli sampling be performed. There is no requirement to do Legionella or other waterborne pathogens. So these pathogens can evade or survive that disinfection process and be present at the time of beneficial occupancy. So when we talk about water management teams, I mentioned that a multidisciplinary team should be engaged in the risk assessment process, whether that's just for a generally built environment that's already built or as part of construction of a new system. And really, there should be a lot of different perspectives on this team. There should be somebody who understands the facility and the water systems that will be present. There needs to be somebody who has infection prevention or environmental health experience that can help drive decisions with respect to control measures. And there should be somebody that can oversee the program and has authority to really identify resources that can be dedicated towards implementing control measures. And then really also somebody who can confirm the program performance, someone who can take validation samples, someone who can interpret the records to ensure that the records are being collected on time and stored correctly. So all of these people are really critical members of the water management team. And that water management team, as I mentioned, should really be involved in the design phases of all construction projects. They can provide recommendations, for example, for where to install flushing points, where to install sampling points. I can't tell you how many times I've gone into a building and tried to sample the hot water return, and there just is no hose bib or no sampling point where domestic hot water return water can actually be sampled. They can make recommendations about pipe sizing to make sure that water, not only that the pipe is sized appropriately for occupancy so that we don't have too much water sitting in the pipes, but that we also can achieve enough velocity during flushing to really help move water through the building. And then we can also think about what water quality measurements need to be taken as part of construction so that we can plan accordingly for what control measures we need to implement as part of occupancy. And then, of course, also worker safety should be considered by the water management team as well. The water management team can also make recommendations for where cross-connection control has to occur. They can make recommendations for pressure testing for the system. Most times I see that water is used for pressure testing, but there are other alternatives, nitrogen or dry air, and this can help to minimize the period of time that water is sitting stagnant in the pipes. If you use air, then we don't have to fill and test the system until the commissioning phase later on. The team can also give recommendations about phasing considerations. You know, at what point do we think, how do we think about waterborne pathogens as part of phasing? And do we need to, incorporate that as part of our design phase considerations. And then they can also make recommendations for how to use water, whether that's temporary water sources or how to properly use the building water system during the construction phases. Water conservation always comes up, certainly in California where I live, where water resources can be scarce. But the team really should be involved in decisions related to water conservation. So discussions about low use fixtures, fixtures that maybe conserve water might also lead to stagnation and can increase the risk for Legionella and other waterborne pathogen growth. So perhaps low water fixtures maybe shouldn't be used in high risk patient areas, for example, or maybe there are other alternatives that the team can consider. They should certainly consider patient susceptibility, as I mentioned, when evaluating water conservation and water conservation measures. And design engineers can also think about water conservation, not just by fixtures, but actually by minimizing the water volume in pipes, while also making sure that there's sufficient volume for use and for flushing. We can think about strategic points for flushing, so installing flushing valves in strategic areas. And we can also think about implementing self-flushing fixtures or even combination fixtures. Chicago Faucets has a great portfolio of fixtures that self-flush or automatically flush or can drain when they're not in use. If examples are showerhead, their showerhead design can drain the handle of a handle style shower while it's sitting there not in use. There's examples of combination fixtures, for example, eye wash stations that are installed at a faucet instead of being a separate standalone equipment. And so those types of decisions and types of things can be considered as part of supporting water conservation as part of the design phase. I think I talked about this previously, but again, just thinking about installing flushing points and implementing pipe sizing to really help consider flushing considerations later on as part of water management during the water management plan phase. And then finally, this is just an example coming from the IAPMO document that talks about water management minimum design requirements or needs according to the building type. So again, looking at whether it's a simple building, a type A building, or maybe it's a more complex building, and what things need to be thought about as part of design by the water management team. So that construction practices resource is a really great document for the water management team to rely upon and use. And then they also give specific recommended criteria, things to think about with respect to flushing points, sampling points, temperature and flow, and other water quality hazards, which should be considered by the water management team during the design phase whenever possible. And really quickly to finish up here, I just want to make a quick note about standard C651. This is an AWWA standard. It's typically it's often cited in plumbing code. It's often implemented for premise plumbing, when in fact it's really designed for disinfecting water mains, which are the large mains that the municipality uses to deliver to the point of connection. So this standard really requires really high level disinfectant, residual disinfectant, which may be damaging to premise plumbing systems, the plumbing systems within the building system. So there is the IAPMO construction practices for potable water document. They give some really good recommendations about what is appropriate for disinfection of premise plumbing as part of commissioning of new pipework, and it can also be extended to emergency disinfection as well. If a building is already built and experiencing a waterborne pathogen problem, this is still a good resource to rely upon. And I think with that, there were some questions that were submitted that I believe will be sent out to the attendees. Thank you so much for your time. Please contact me if you have any questions. Here's my contact information. And thank you so much again to Chicago Faucets for inviting me to speak with you today.